great instructions and awesome scenarios. We got to learn a lot from today's class. So that was superb instruction. So chorus, I'll be taking you through the next chapters on eye, pain and psychiatric. So let's move on. And now it's time for some fun time. Let's have some fun time with the pop quiz. Are you ready for some quiz, coders? Yes. So I want everyone to be involved and let's have some fun on these guidelines. So this is a true or false scenario for you. Behavior disorders due to psychoactive substance use are only coded based on the provider's documentation. Is this statement true or false? Okay, the chat is on fire and everyone is unanimously saying the same answer. True. Yes, the behavioral disorders due to psychoactive substances are only coded based on the doctor's provider's documentation. And the guidelines reference to this is C5PI. Now let's move on to the other next one. True or false? When the provider documents the use, abuse, and dependence of the same substance and all are present in documentation during the encounter, code them all. Is this statement true or false? Okay, I can see your responses coming up in the chat. Great. You guys all have done a phenomenal work on these guidelines. Exactly, it is a false. So whenever you see a use, abuse, and dependence all in the same document, all in the same case, there is a hierarchy to be followed. When you have a use, abuse, and dependence, code the dependence. And when you have use and abuse, code the abuse. So that is how you have to do. Highest step documented is your answer. So great work on the chat. Let's move on to the next. Let's see what we're having next. Yes, the guidelines referenced for this one is C5B.2. So next, true or false statement. In chapter 6 pertaining to the dominant and non-dominant side, when a dominancy is unknown or undocumented, the default would be right side dominant. Is this statement true or false? There you go. Everyone are on the same page. They all are saying it's true. Exactly. True is the answer for this, and the guidelines you can refer for C6.A. There is, it's where you can find this particular guideline. Next one, when pain control or oops, I think I'm having already answer for this on the screen. When the pain control or pain management is a reason for the admission or reason for the encounter, yes, it can be listed for. So this is a true. This statement is a true. Still, I can see the answers in the chat. Yes, so that's a learning one. That's a learning moment. And the guidelines, I could have asked this for you. I could have asked for the guidelines. And the guidelines which we would refer is C6.B.1A. Yes. Next one. Pain due to implant grafts are coded under chapter 16. This one is going to be interesting. Let me see. Let me have a look into the chat. Is it a statement true or false? Okay. Okay. I see mixed response for this one. The answer is false. Coded it is, these are coded in the chapter 19 pain due to medical device, and the guidelines you can refer C5.2. B.2. So I think that was a teachable one. Yes, that was a teachable moment. Oops, next one. The patient admitted with a glaucoma and stage evolves during the admission, assigned the highest.
Thanks for tuning in, and until next time, happy coding!